Number of patients and adequacy of resources. The final part of the scene size up is determining if you have sufficient resources to handle the call. If, for example, you noted a two-car collision where there were at least two patients, one driver still in his car and the other thrown to the pavement, you would immediately request an additional ambulance. As you approach the scene, you should actively look for clues that there may be additional patients, other passengers, or pedestrians involved in the collision, and if so, you should immediately call for additional ambulances. Sometimes you may discover a need for additional resources, even in a situation that at first would not seem to require them. For example, you may not feel that a single patient medical call could tax your resources, but consider the following scenarios where you may find yourself needing extra help. Your ambulance is called to respond to an elderly woman with chest pain. You are greeted at the door by her husband, who does not look well. He denies any complaints, but is sweaty and holding his chest. Your first patient tells you that her husband has a heart condition. A single patient experiences back pain. This is usually not a reason for additional assistance, but this patient is in a third-floor apartment with no elevator and weighs 425 pounds. Your ambulance is called for a patient with general weakness. Upon arrival, you and your partner, two more persons in the arrival of you and your partner, two more persons in the same family develop the same flu-like symptoms. You appropriately suspect carbon monoxide poisoning, since they admit that they have been having furnace problems. In each of these situations, what appeared to be a routine one-patient call actually turned out to be more. An important part of scene size up is to recognize these situations and call for help immediately. As the call progresses and you get more involved in patient care, it is less likely that you will remember to call for the additional help. It may also be too late when the help arrives if you do not call immediately. Your response can range from simply calling for another ambulance to care for the ill husband in the first situation, or extra personnel to help move the 425-pound man in the second, to activating a multiple casualty incident for the family with carbon monoxide poisoning. You will learn about multiple casualty incidents in hazardous materials, multiple casualty incidents, and incident management. Try to anticipate the maximum number of patients and radio for help accordingly. Follow local protocols. Critical decision making. Determining areas of concern at the scene. The scene size up is a vital part of any call. For each of the following scenes, determine a few areas of concern you would want to check before proceeding to the patient. Remember each of the components of the scene size up. You shouldn't try to think of every possibility, only the most likely ones. Practice the critical thinking process of evaluating a scene, something you will do on every call. 1. An 18-wheeler with an enclosed trailer slid off the road into a ditch in an ice storm. The vehicle is in the ditch, leaning to the right. 2. A van and a passenger collided on an interstate highway. 3. You arrive at an office building and see people running out the front door and side doors in a panic. One person appears bloody and is running towards your ambulance. 4. You respond to a residence with the fire department and arrive on scene first. A resident meets you at the end of the driveway and tells you there's a strong smell of natural gas in his house. 5. You respond to a construction site for a fall.